buddy Kimberly here, and I swear I was out for a walk, and it was daylight, and anyway, we got hit with a big storm. So unfortunately now we get the late night video. Actually, it's not actually that late, it's like 6:30ish. Anyway, so I just wanted to give a quick update. Well, two things. So I'm actually going to post this video before the one I did over the weekend with one of my good friends, girls, who are just the greatest. They're like the girls I never had. And I am very happy that I have a son, but how nice is it to have two little girls that are you know, kind of the girls you never had, right? So they're so sweet, and they wanted to do my video for me, direct, produce, and I had a makeup artist as well, but they wanted to do the video of me putting on my fake eyelashes that I promised I was going to do. So this video might actually make it up on YouTube before that one does, but I wanted to give the girls a shout out and say thank you. It was a lot of fun. I don't know, we have a lot of outtakes. I'm not sure if there's actually one solid video that we could put out there. We might have to do it again, girls, but I wanted to give you guys a shout out and say thanks so much, because it was really a lot of fun. It was great. Again, just I will refer to them as DNA, the DNA. So anyway, let's see, so it is 2 weeks from when I had my nerve root block, and so I wanted to touch base. Look, I touched base with you guys a couple of days ago about that. Nothing really changed, but today was the official follow-up with my pain management physician. So this was what he was able to tell me, because I did have actually 7 to 8 pain-free days where there was like no numbness, no pain in the foot at the same time, and I wasn't having to take my release actually, and still no pain. That somewhere between S1 and L5, which is where he stuck that needle in for the nerve root block, is the offending nerve. So I don't know that it told us much, except that somewhere in between those levels there is an offending nerve. He has now scheduled me for another nerve root block in 2 weeks from now. I'm really gonna have to muster up all of my strength, because the steroids that they put in, you know, it really, I get a lot of systemic lashback from it. You know, I get the rashes, the itchiness, the moodiness, the flushing, you know, it's really uncomfortable for me. So he did say that he would put in maybe a little less, but I guess now we're just going to go in at L4, see if that's the offender. But I'm really sort of afraid that his tactic is going to be, okay, if it's not L4, is it, you know, the one below that, the one below that, till S1? I don't know how much of that I can stand. However, we do need to find which nerve is the offending nerve, and I guess from there they can burn it. It doesn't sound good to me. So other than that, that's kind of where I'm at the moment. I'm back to the release, unfortunately, and just my standard regimen. I'm trying to do my best with physical therapy, but it's killing, you know, it's really killing. However, I will say that you know, more activity is better than less activity. It is the toughest thing, and I know it's easier said than done, but even when you're in pain, if you've been cleared for physical therapy and for walking, you got to get out there and do it. It really does make you feel better afterwards. So in my next video, which I might actually do later this evening, I want to talk about the two. I have two tumors. And I've never discussed this. They are on my back, one on the left, one on the right. They're twins. And actually my pain management physician within the office in 3 visits removed one of them via syringe. It has been wonderful. They were getting to be just so uncomfortable and had sort of their own symptoms. And the one on the right has just been so troublesome. He tried to remove it even during the nerve root block when I was all numb, and that did not work. So today in the office, just for, you know, poops and giggles, we tried to remove it again on the right side, and it was extremely painful. So coming out here to take a walk was not anything you know, that I had planned, but I know that just out walking it makes me feel better. I always feel better afterwards, and it's just worth it. So to those of you out there who, you know, you want to do the rest, ice, repeat, absolutely. But if your doctor has cleared you for activity, get out and move, because the less you move, the less you will move. And the more pain you'll actually be in. So anyway, I want everybody to have a great night, and again, you know, thanks DNA guys, I appreciate your help over the weekend. I will take a look at that footage and see what we can put together. If not, then I will need your assistance. We'll have to do another video now that you guys are experts. So anyway, take care everybody, have a great night. Thanks.